Knock knock.
Hello, my name is Dominique. I'll be your nurse for today.
Hi.
And can I have your name?
Jessica.
Jessica? Okay, well, nice to meet you.
Likewise.
So what brings you in today?
Well, mainly I have some tenderness on the left side of my stomach, and
Okay.
I thought it would come in and see
Okay,
if I'm
perfect.
okay.
And we'll do a whole physical exam and
Okay.
see what's going on.
Okay.
I'm going to ask you some questions so you know what today's day is.
I do. November
At this point in the interview, the nurse is going to assess the level of orientation of the patient by asking the patient a few questions.
Central.
Thank you. And, can you give me your date of birth?
Yes, it is December 25th, 1982.
Okay. Nice. Thank you. Okay, so I'm going to just go and ask you some personal questions just to get some information from you.
Sure.
The nurse assesses current problems first using symptom analysis. She will then move on to assess personal and family history to determine genetic risk factors. After this initial assessment, the nurse assesses other risk factors and teaches about those that may be modified.
About how much?
At this point in the interview, the nurse is going to begin to perform her skin assessment. The patient has been undressed and put in a hospital gown. The nurse has washed her hands and is now applying her
Very
gloves.
first thing I'm doing is inspecting the face, and I'm looking for symmetry.
Okay.
So just making sure everything is okay and everything's.
The nurse begins with inspection. She's first looking to see if the head is midline to the body, if the eyes, the nose, the ears, and the mouth are all symmetrical, and is there any obvious abnormalities of the face. The nurse will begin superiorly by assessing the patient's head and scalp. She's looking to see how well the hair is evenly distributed, if there's any lice, any nits, any dandruffs. She will also begin to palpate, and she's looking for any pain or any tenderness. The nurse has removed her gloves and has re-washed her hands. She now begins to assess the patient's arms. She has now instructed her to turn so that she can now inspect and assess the back. She will now instruct Jessica to lay back and turn to her side so that she can assess the posterior area. She will then have the patient lay supine where she will begin to assess the skin of the lower extremities.
Okay, so everything looks to be okay. Take a look at your chest area as well, and I will also inspect and take a look at the skin of the chest and the abdomen.
Okay.
so now I'm going to begin your abdominal assessment. So I'm going to first start off by inspecting. So can I take this down? Okay, so I'm going to just look
At this point in the interview, the nurse has begun to do her abdominal assessment. She first began with inspection, and she's looking at the condition of the skin and umbilicus. She looks at the bottom for couture, peristaltic waves, and pulsation. She inspects for size, shape, and symmetry. She has now begun to auscultate the quadrants of the abdomen by first starting at the iliac valve, slightly right and below the umbilicus. She is listening for hypo, hyper, or normal active vowel sounds. If no sounds are audible, she will listen for up to 5 minutes before reporting those findings to the primary healthcare provider.
Okay, I'm going to switch it over. I'm going to listen to the bell, and I'm going to listen to your abdominal sounds as well. I'm going to start at the
She has now begun to auscultate the vascular sounds of the abdomen by using the bell instead of the diaphragm. She is going to start at the right femoral artery, moving up to the right iliac, the right renal, the aorta, the left renal, the left iliac, and lastly the left femoral artery. She will now begin to percuss all 4 quadrants, and she's listening carefully for tympany or dullness. She's going to begin at the right lower quadrant, moving clockwise. The nurse is now going to assess the size of the liver as well as percuss the liver.
And then I will use this to measure to make sure it's a normal size. Okay.
She would also assess the size as well as percuss the spleen. She will then move on to begin palpation of the abdomen by starting with light palpation. She's going to press down 1 to 2 centimeters in a rotating motion and then lift her fingertips to move to the next location. She is looking for nonverbal signs of pain such as grimacing and guarding. She is now going to move on to deep palpation of the abdomen to assess organs, masses, and tenderness. She is going to perform this single-handed deep palpation using the tips of her fingers and depressing 4 to 6 centimeters in a dipping motion. She will also palpate the liver as well as the spleen.
Okay. So it seems like everything is okay for now. I'm going to go ahead and notify the doctor, let him know that you have pain in your left lower quadrant. Is there anything else that I can probably assist you with right now?
No, just that. Thank you.
Okay, thank you.
Okay, Jessica, so what we're going to do now is I'm going to teach you how to do the self-scan assessment.
Okay.
And the reason for this is that it helps patients identify problem lesions through the detection of moles.
Okay.
And so the very first thing I just want to explain is that you can start to pay attention to your moles by remembering the mnemonic A, B, C, D, E.
Okay.
The A standing for asymmetry. The nurse will making sure now that they're explain both what A, symmetrical, B,
or
C,
if
D,
they're
E
not, then
stands
that's what- that
for.
can raise a
A
concern.
meaning asymmetry,
B is
B
the
meaning
borders,
border
and,
irregularity,
a size smaller than
C
6
meaning
mm
color, D
diameter
diameter
is
of more
good
than
for
6
the size of the
mm,
mole.
and E
Then you wanna
evolution
see
of
if
lesion
there are
over time.
well-defined edges. So when you're home, you want to stand in front of a mirror.
Okay.
That would be helpful, and you can take a look to detect lesions or moles of your skin.
Sure.
So first, go ahead and raise your arms and examine the body from front to back, and then right sides and left sides. Go ahead now and you bend your elbows. Look carefully at the forearms and back of the upper arms and palms. And you're just looking at the skin. So next you want to, it might be helpful, I don't know if you want to sit or stand, you want to look at the back of your legs and your feet
Okay.
in spaces. And that's why I say it's good to probably have a mirror.
Okay.
And look between the toes and soles of your feet.
Okay.
Okay, and then you're going to examine the back of the neck and the scalp when with like a handheld mirror if you have one.
Okay. I
It'll
do have
help
one
as
at
well.
home. Okay.
And part your hair so you
Okay.
can get all back there.
Okay.
And finally, check the back and the buttocks with like a mirror. So you'll use your handheld mirror and you will check a look at the back of the buttocks as
like
well.
this.
Yes.
Okay. I can do
And that would like complete your self-scan assessment. And if you notice any changes, you definitely want to contact your primary healthcare provider.
Okay, thank you,
Uh-huh.
nurse.